Hi, this is Nicholas Yock from Pathway to Oz, and today we're going to discuss studying nursing in Australia. Australian colleges and universities produce some of the most highly trained and sought after nurses in the world, and international students can study either a Diploma of Nursing or a Bachelor of Nursing in Australia. A Diploma of Nursing is the education required to work as an enrolled nurse in Australia. A Bachelor of Nursing is the education required to work as a registered nurse in Australia. Australian nurses are in high demand in Australia and around the world. Please note, nursing or registered nurses are currently on the medium to long-term list. So what is the difference between an enrolled nurse and a registered nurse? A registered nurse is someone who has completed a bachelor degree at a university level. A registered nurse can do things like facilitate, implement and update healthcare plans of a patient. A registered nurse will have a lot more responsibility than an enrolled nurse. An enrolled nurse will, generally speaking, work under the direct supervision of a registered nurse and doesn't quite have the same accountability as a registered nurse, so they can't really act independently. So a Diploma of Nursing is, generally speaking, about 1.5 years in length. It can be done at TAFE or other private providers. It'll generally cost about $8,000 a semester. And as part of the course, there'll usually be, some workplace-based components. So you'll be, expected to do some work experience at a hospital, aged care facility, etc. So a Bachelor of Nursing is generally 3 years in length. Some universities, will allow you to do will have a sort of expedited program where you can do it in only 2 years if you've previously held a bachelor degree. Bachelor of Nursing obviously must be done at university. It's also significantly more expensive, so it's about $13,000 per semester, and there'll usually be a significant amount of workplace-based components for the course. So it is very common for someone who has previously done a Diploma of Nursing to then go on and do the Bachelor of Nursing. If you've done the Diploma of Nursing, you'll usually also be given credit, which will go towards the Bachelor of Nursing, which will shorten the length of the course. And the reason why people would do this is that, well, one, it's significantly cheaper. Two, when you finish the Diploma of Nursing, you're actually an enrolled nurse, so you can continue to work in the industry when you're studying for the Bachelor of Nursing as well. So where can I study the program? So look, the Diploma in Bachelor of Nursing is offered at a lot of providers in most major cities and even some regional areas around Australia. So what are the requirements for entry for international students? Firstly, you need to speak English very well. Generally speaking, the English requirement is IELTS 7s in most aspects. If you can't quite meet the English requirements, some colleges may allow you to first do a short study of English to boost your English level up to that requirement. Please note, if you're from an English speaking background such as the UK, Canada, USA, Ireland, you generally speaking won't need to provide evidence of English. To be able to enroll in a Bachelor or Diploma of Nursing, you also need to have completed your secondary schooling. So what are the outcomes at the end of the course? Well look, most of these programs, if you study anywhere in Australia, they'll be accredited by ANMAC, which means that once you finish your studies, you'll be able to become registered in Australia as an enrolled or registered nurse. Please note, if you study a Bachelor of Nursing and you do the course for at least 2 years or more, you should then potentially be eligible for the graduate work visa, which will allow you to remain in Australia and live and work upon completion of your studies. There is actually a separate video which discusses this, and I'll put the link in the comments below. Registered nurse is also on the government's medium to long-term list, which means that the occupation is in demand in Australia, which means that once you finish the course, you might also be eligible to apply for different general skilled migration visas. We have assisted numerous clients who have studied, different Bachelor of Nursing programs in Australia successfully migrate to Australia through the Skilled Independent Visa, subclass 189, or the State Nominated Visa, subclass 190. We'll also put some of the links to their testimonials in the comments below. If you are interested in studying nursing in Australia, feel free to contact Pathway to Oz. We'll show you some of the different education providers, the locations, costs, etc. Thank you.